Hi, I'm Dr. Joseph, founder of the Joseph Spine Institute. In this segment, I will explain an innovative new minimally invasive technique that I have personally developed in an ongoing effort to offer my patients the very best surgical methods available. This innovative new transforaminal lumbar endoscopic interbody fusion, or ETDIF, is a revolutionary minimally invasive spinal fusion technique that combines the precision of the endoscope and a new breakthrough on spinal fusion implant that features an expandable cage. An endoscopic fusion is similar to an open fusion surgery, but includes the use of a minimally invasive approach with a tiny camera, the endoscope, that sends images to a monitor. This technique may eliminate the need for anesthesia with less risk and faster recovery. An endoscopic approach involves tubes inserted into the operative area using relatively small incisions, with a camera to provide visibility to the surgeon and small instruments inserted through these tubes to conduct the operation. Confining all instruments to the tube, or sometimes two tubes, it is designed to minimize disruption to the surrounding tissue and bone with the goal of less tissue damage and faster healing times. In preparation for the procedure, the patient lies face down to prepare for the procedure. General anesthesia may be used. There is a good possibility that general anesthesia may be avoided in some of the selected patients. An incision of about 1 centimeter is made on the most symptomatic side of the spine at the level of the problematic disc. Fluoroscopy, which is a live X-ray, is used for visualization to identify the appropriate disc. We then prepare the disc for fusion. A thin tube is inserted through the incision and into the disc area through the neuroforaminal opening. This is the channel through which the nerves exit the spinal canal. A dilator is initially used to enlarge the size of the tube and provide a working channel for the operative instruments. The endoscope is inserted through the tube into the disc to allow the surgeon to access the disc. The disc area is irrigated with antibiotic solution, minimizing the risk of postoperative infection. Special instruments are then inserted into the tube or tubes to remove the damaged portion of the disc, and the parts that are cut out are extracted through the tube. Cartilage, which covers the surface of the bones bordering the disc, is removed through the tube as well. Dilators are then inserted into the disc to restore the disc height and normal spacing between the vertebrae as necessary. This concludes the part of the operation that prepares the disc for the fusion. The success of the disc preparation is confirmed endoscopically with the camera. This part of the process is essential to ensure that the bone graft inserted into the disc space is likely to fuse to the bone surfaces that were bordering the disc. We're now talking about inserting the expandable cage. This cage is inserted into the disc space. The cage provides a minimal insertion profile designed with less neural retraction. Once the cage expands, this allows for maximal graft delivery. The volume is only restricted by the amount of disc that is removed. Once the cage is placed, the tube is removed, absorbable sutures are used to close the wound, and the surgical tract is infiltrated with local anesthetic for immediate postoperative pain control. Antibiotic dressing is also placed on the wound. In some cases, screws are used with rods to reinforce the cage. This may be attached to the back of the vertebra to add stability and prevent movement while the bone graft sets. The bone graft fosters this bone growth around the rods and the screws and are typically left in place once the bone graft takes hold. The procedure is approximately 1 to 1.5 hours and is usually performed as an outpatient surgery. For more information about our services or about this procedure, please contact our office via our website or the number on your screen. Thank you.